pushing protein and cutting sugar. That is the general message from the Trump administration's new nutrition guidelines, featuring an inverted food pyramid with red meat and healthy fats right at the top. Joining us live with more, I'm pleased to say, from the FDA is FDA Commissioner Dr. Marty Makary. Dr. Makary, great to have you with us. So before we get into the specific recommendations, let's talk about the why, because the last time that these guidelines were updated was, I believe, in late 2020, which was during the first Trump administration. So what has changed in the past 5-6 years that led you to this update today?
Well, good to be with you, Katie. There's been a revolution in nutrition science, recognizing that we have been misled with 60 years of dogma that has determined that we need to have a myopic focus on demonizing fat, for example. We now know that's not true. The field of nutrition has matured to recognize now the importance of protein. So today's new nutrition guidance increases the protein recommendation by 50 to 100%. It shouldn't be at a level so you just don't wither away. We want Americans to thrive. You need amino acids, and you don't have protein reserves in your body like you do for glycogen and fatty acids in the liver. And so when you don't get enough protein, you have muscle wasting. Turns out that one of the best predictors of longevity is muscle mass. And so it's no wonder that we're seeing life expectancy come down and more frailty in older people with nourishing people with protein. That's one of the new guidances, along with looking at ultra-processed foods, refined carbohydrates, and the types of grains you got. We don't want people having grains stripped of fiber and chopped up that essentially function as sugar.
Well, you mentioned ultra-processed foods, and that is one of the explicit recommendations here, is to cut back on that. But my understanding is that basically the government is still working on a definition of what ultra-processed foods are. So with that in mind, how do you expect that this recommendation will actually get implemented?
Well, I think we all know it when we see it. Ultra-processed foods are the foods with 20 or 50 different ingredients on the back of the package. There are things that should go bad in nature, but they last for months or years on the shelf without refrigeration. So we are at the FDA creating a more formal definition of ultra-processed foods, and that could be used for education. It could be used for front of package labeling. We have put out an RFI, and industry is submitting their ideas. Nobody has a perfect definition, but we want to get one that can be used for mass public education, because 40% of our nation's kids have a chronic disease. America's kids are sick. It turns out that 60 to 70% of the calories kids in America get today are ultra-processed foods. We're calling that out in today's new nutrition guidance, and we're setting the record straight.
Well, with regards to that, and I am curious, as this pyramid gets rolled out, I mean, most of us, of course, as children, remember just how prominent those pyramids were in our school system. Has there already been discussions about how public schools across the nation are going to adapt their menus to these new guidelines?
There are starting today with the new guidance, Romaine, and that's because people are recognizing that they were misled. Remember in school when we were encouraged to drink low-fat milk? Ironically, they took out natural saturated fats that are not bad for kids, and they added sugar. And so we now recognize that it wasn't one single ingredient that caused our chronic disease epidemic, that is saturated healthy fats. It is the ultra-processed food, refined carbohydrates, lack of fiber, and the immense amounts of added sugar. Romaine, you and I were part of the first generation to have massive insulin spikes in our blood system because of the food we ate. We'd never seen that before in human history. It's no wonder that we're dealing with a diabetes and obesity epidemic. These are the root causes of so many other problems in healthcare. So in a sense, this is a healthcare reform dealing with the root cause.
And I just have to ask, I mean, you think about X, essentially, the food pyramid, you talk about it in school, and then you kind of forget it. I think that most American adults don't spend much time thinking about the pyramid when it comes to making nutrition decisions. So just more broadly speaking, how do you increase the relevance of these recommendations?
We want every school district, every house of worship, every family to have a conversation about what's in our new nutrition guidance. That's why it's short. It's less than 10 pages, not like these previous guidances that were over 200 pages. It needs to be understandable. It needs to identify things like coconut oil and olive oil and the importance of healthy nuts and seeds. We have tried hard to make a couple clean messages, and that is we need more protein in the body, and we need to watch out for the ultra-processed foods and the sugars. It turns out that ignoring that has been part of the problem, and so we're putting that back on the radar.
Dr. Makary, I know this is the big topic of the day for you, but I do have to ask you about what's been going on with regards to flu cases here in the United States. We're now seeing our highest level of flu incidents in about 25 years. There have been widespread reports of people not being able to get over-the-counter medications like Tamiflu on the shelves, not being able to get prescription flu shots. What discussions are taking place right now at the FDA about trying to curb the continued outbreak of this flu virus?
Well, look, this appears to be not only a big flu season, but a flu season that's coming earlier in the year. And so this is a problem that I dealt with as a physician. You'd see an influx of patients coming into the hospital. The root cause of some people needing to come to the hospital is they don't have good underlying health. They have underlying insulin resistance and obesity. But in dealing with the issue at hand today, we want people to know about their options. The flu shot is widely available. It's not a great match this year, but this has been going on for a long time.
Why isn't it a great match, Dr. Makary?
Well, because to give you very sort of a technical reason, the influenza virus has two very flimsy polymerases, which allows it to mutate much faster, about 35 times faster than the COVID virus. And so you can have a match early in the season, and then the flu essentially mutates at a point where the vaccine just doesn't work. Now, we are outlining a very clear goal at the FDA that we would like to see a universal flu shot. If it can be shown to be safe and effective, we would like to see these new promising technologies that target the stalk, that is a different part of the influenza virus, or that have immunity, create immunity to multiple different parts of an influenza virus, including parts that have not yet mutated. These are two ideas out there. They are actively on our radar, and we have said very openly ever since I came into office 10 months ago that we would like to see a universal flu shot that could potentially give you decades of lifelong protection.
Did the lack of this synchronicity in that shot and what this influenza virus is, does that have any connection to some of the shortcomings that we've seen with regards to staffing at the U.S. health agencies?
No. First of all, I think it's important for people to know there were no scientific reviewers that were laid off at the FDA, and what we saw was a consolidation of different IT departments and HR staff at the FDA. The FDA is strong and will continue to be strong. We met all of our user fee target dates this year. We have a record number of approvals in CBER last month. And I'm going to be reporting all the metrics at the upcoming JP Morgan conference next week. But no, it's unrelated.